Hi all, I am Dr. Vishnu Namboothiry. I am a BMS doctor having my MD in the now, and I have my MSc in yoga and also PG DYT in yoga therapy. I am senior medical officer to the Indian Systems of Medicine Kerala, but now I am on leave and I am in charge of Sreerudra Ayurveda Multi-Speciality Hospital, which is an NABH accredited hospital situated in Alappuzha in our God's own country, Kerala. Today we will talk about a disease called Parkinsonism. Nowadays we all are familiar with the term Parkinsonism. It's a disease mostly affecting the brain, and since it's a disease of old age, it is now increasing in an unprecedented level in our community. As we know, old age people are nowadays getting more in number. Hence, the disease also is very common. Mostly this disease affects men rather than women. The reason for this is very unknown. Even after much scientific advancement, the reason for being a disease of man is unknown. But still, there is chances that women can also be affected with the disease. Around 60% of affected people are men, but and the disease usually affects, as we know, the neurons, that's the nerve cells of our brain, especially the nerve cells of the basal ganglia. There is a structure called substantia nigra, which produces dopamine, which is sole responsible for the movement and also for rewarding. Hence, when the substantia nigra is degenerated or due to some issues, it may not be able to produce enough dopamine. The condition results in Parkinsonism. There are many reasons for Parkinsonism. Still, the scientific world is unknown about the exact reason for the degeneration of substantia nigra, thereby resulting in Parkinsonism. Some proposes genetic reasons and some proposes some environmental factors which affects the substantia nigra in producing dopamine. Apart from the reduction in dopamine, the norepinephrine, which is also a neurotransmitter, is also reduced in many of the Parkinson's cases. Mostly the symptoms of Parkinsonism are tremor, fine tremor, especially some uncontrolled movements like pill rolling movements are seen in this type of patients, and a specific gait which is called Parkinson's gait with a forward bending stupor with and also with low levels of arm movements, fast but very short steps, and also sometimes they may not be able to pull up the feet from the ground, so that sticky nature of the foot is seen. Apart from the movement problems, and mostly this patient may experience difficulty in carrying out their daily routines like cleaning up their beards, shaping their mustache, etc. Apart from that, apart from these movement problems, many cognitive issues are also seen. Sometimes most of the patients at a later stages shows some memory issues and also some emotional issues, and their face usually represents a masked face. Mostly the patients may not be aware about their condition in an early stage, but relatives and friends may able to find out some changes in their daily activities and also their expressions and also their movements, etc., that may be leading to the diagnosis of Parkinsonism. According to Ayurveda, Parkinson's disease is a Vada disease. That means Vada, which is the most predominant among the three doshas, and which is mostly involved in all movements of our body, is vitiated, and hence this Vada vitiation leads to all problems with the Parkinsonism. There are so many Vada rogas, almost 80 Vada rogas are said in Ashtanga Hridaya and in many other classics, which involves the Vada dosha alone. But in Parkinson's, mostly Pitta and Kapha are also involved, but Vada is vitiated more. And hence, the treatment of Parkinsonism, according to Ayurveda, includes the pacification of Vada as well as keeping the balance of Pitta and Kapha. So, before going to the Ayurvedic treatment part, let's discuss more about this Parkinson's disease according to Ayurvedic concepts. According to Ayurvedic concepts, Parkinson's disease, as I have told, is a Vada problem. In many Ayurvedic texts, it is designated as Kambavada. There are two types of Parkinsonism. One is Kamba Pradhana, in which the tremor and usual falls and unwanted or unintended movements are mostly seen as prime symptoms, and Stamba Pradhana, in which mostly the movements are affected and they will be slow and rather dull, and the patient may not be able to move as intended. So, in Kamba Pradhana conditions, there is more vitiation of Vada, and in Samba Pradhana, the movement of Vada is blocked. According to Ayurvedic concepts, even though the Parkinson's disease is incurable, the progression and the difficulties which are faced by these patients can be controlled in a manner so that they can carry out their daily activities.